So the difference between disease modification and symptomatic effects is that a disease modifying effect actually builds up over time. You get a little bit more effect every time you're taking the treatment or every time the intervention has been applied. And with the symptomatic effect, you get the effect when you take the medication, and then it goes away when the medication goes away. And so in terms of degenerative diseases that are accumulating over time, a disease modifying effect is much better for counteracting that slow accumulation of disease that you have with a degenerative disease. And so right now in the Alzheimer's field, we're starting to get into the space where we have disease modifying effects, and we should be distinguishing between them in the way that we analyze the data and be able to give essentially more credit to those treatments that are really interfering with the process in a way that accumulates over time. So the types of things we use to separate these effects out are, first of all, just a slope separation is usually indicative of an accumulating benefit. There are ways to get slope separation that isn't necessarily disease modification, but in most cases that is an indication that it's disease modifying. And then of course there are study designs that have been planned specifically for this, like a randomized off and a delayed start design. And whenever you do an open label extension to a randomized trial, you collect data that can be thought of as a staggered start type of a design, and you can analyze it in a way that the rasagiline trials did several years ago and figure out whether the effect seems to be permanent. And what you do is you say, do people who went on treatment initially end up at the same place as people who went on treatment later? And the idea is if they're never quite the same, then you know the people who went on treatment earlier continue to keep that benefit from that earlier treatment. So that's an analysis that a lot of people can do with their open label extension data. We do have slope separation. Certainly many of these show slope separation, although in some cases the slopes end up being parallel after some amount of time, indicating that maybe the benefit accumulates for the first part of the intervention, and then after that maybe just maintains that separation. When we do open label extensions, often there is still an advantage to people who've been on it longer, and that would be consistent with disease modification as well. So I would say we have preliminary evidence for this for the monoclonal antibodies, but we should be looking for additional evidence to support this.